And here we go. Welcome everybody to The Big Idea. I'm Dr. Jeffrey Hanna here with Clear Chiropractic, and today we are doing a bit of a case review. This is a gentleman who I met just for the first time in the last week who asked me to do a video here and didn't mind sharing it, not letting you know who the individual is or anything like that, because he's been experiencing progressive dizziness that is affecting him in pretty much all of his day-to-day activities. He's seen a few of the other videos on the channel and said, you know, it sounds like we're ticking a whole bunch of the different boxes. So we're going to actually go through, show you this gentleman's test results, and illustrate what the different factors are that are going on. Hopefully this would be informative and also valuable for other people who might be experiencing some of these different kinds of issues. So let's go ahead, jump into it. All right, first, I need to give you a little bit of a background just in terms of what this fellow has going on. Like I said, he's experiencing dizziness. It's been going on for a number of years at this point, and he relayed to me that he had a number of physical injuries in the past. One of them was getting knocked over by his brothers when he was playing around as a little kid, got knocked unconscious. In the early 1980s, he got kicked in the head by a horse. Some years later, he had a fall and ended up hitting the left side of his head, and he said that he felt every single bone in his neck just go pop, 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 pop all the way through. Now, he was living in the country and so never went to have any medical tests or anything like that, never really had any treatment. So here we are many years, many decades later. So we started doing a bit of an assessment. Oh, and he also relayed that he's starting to, or has been having over the last series of years, increasing memory issues. And in fact, he said that he does have a bit of an issue with the sense of smell. So, right off the bat, I'm worried that these are a few signs of neurodegeneration, not necessarily an Alzheimer's dementia, but simply put, brain is not working quite as good as we should otherwise expect it to be. So I've already recommended one of the other videos that's here on the channel where we talk about some of the different supplements that help promote brain health, because I know that that's going to be super duper important for his overall recovery. But I'll let you know what some of the things that we found when doing his initial exam. So number one is he was simply put standing up. No problem with balance there, but the second that I said close your eyes, he started to fall backward. His brain couldn't process that. So this tells me that the primary processing centers of the brain are not firing the exact right way. He was not showing me any flickering signs with the eyes or anything weird that was saying that it was coming from there, although he does say that he's got slightly blurry vision. And he has had some CTs and MRIs in the past. Everything's been ruled out, no signs of anything pathological. He did have a stroke some many years ago. He's recovered overall pretty good, but having a few issues he's noticing increasingly, whereas his voice is starting to just feel a little bit more off. And then one more thing, simply put, he says that he notices that when he is chewing, his balance feels worse. So we've got a variety of different pieces all going into that. So we're going to try to tie this together and illustrate for you what we found and what it means in terms of his individual case. Let's have a look at his films. Okay, so here we go. We've got a CBCT, so the three-dimensional image of what's going on for the head and also what is going on through the joints of the neck. Now, even though a CBCT does not show soft tissue, so it doesn't show muscles, it doesn't show brain, it doesn't show ligaments and all that sort of stuff, you can look to see the structural relationships of these features as a proxy for what's going on in terms of blood vessels, in terms of muscles, and in terms of brain tissue. So let's have a look at a few things, because we did find that there were a few layers of things that were actually going on. So I'll just sort of scroll you through little bits of orientation. I will point this spot out right here. So here's the left side, here's the right side. You might see that there's this little notch. This is where he said he had gotten hit in the face with by the horse some years ago. But let's go ahead first and have a look at his jaw. This is the right side, and I'll show you the left side in just a sec. Because actually, I'll go back here just a little bit, because this is kind of important. One of the interesting things that this gentleman has is an underbite. So his normal chewing position is where the bottom teeth are actually in front of the top teeth. And he said it's been this way pretty much all of his life. But again, when he's chewing, everything feels worse. And as I've talked about in other videos, and as I've testified personally, if there is a problem with the jaw, it can absolutely make you feel dizzy, because the primary processing centers of the brain that is responsible for tooth position is going to coalesce with oh so much other stuff that's involved with anxiety, that's going to be involved with eye movements, and is necessary for you to be able to maintain your balance and equilibrium, because otherwise your teeth would shatter every single time that you chewed them together. So he has an underbite. So we wanted to have a little look and see what was going on with his jaw structure. So let's get a good slice of it. Yeah, right about there. So this is with his mouth closed. And what we see is overall pretty good amount of functional space on both sides. And again, this is on the right. Now let's scroll over so we're looking at the left side. Okay, an equivalent view. Firstly, I can see that this part of the jaw on the left, it's whittled down a little bit. In other words, there's a bit of degenerative arthritis that tells me this has been here for quite a while. But you'll notice a change in the space. There is more space in the front than there is toward the back. And you may also notice this black little shadow that we see right here. That would be evidence of the meniscoid, or the little bit of cartilage that has all those nerve receptors that helps maintain jaw position. Well, that little guy should be sitting more like right here, and the amount of space that you see right here should actually be more in the back. So his jaw on the left side is being compressed backward, and my suspicion is it's irritating the location of that disc, and this is one of the contributing factors for why he feels dizzy, because when he is chewing food, opening his mouth, this guy would not be moving properly. Now, what was interesting to me was that normally if a person's going to have where their jaw is getting shoved too far backward, they're going to have an overbite. So the top teeth are projecting too far forward, but he has an underbite. So how this has happened, I'm honestly not 100% sure. My suspicion, again, it's been there pretty much all of his life. His body found brilliant ways to adapt for it, but then it's gotten tired to the point where he starts having symptoms. And I let him know this right off the bat, both he and his wife, is that I don't think that he has just this one magic thing going on. So if we can do just one magic adjustment to his neck, or make one magic referral, that it's going to solve absolutely everything. No, instead what I'm seeing is that there's this piece of the puzzle that's probably responsible for about 20% of the problem. Here's another 20%, here's another 20%, here's another 20%, here's another 20%. Now that, obviously, if you're doing your math, that's going to be a little bit more than 100%, but you get the idea. There are more pieces to the puzzle here than just one magic solution. So right off the bat here, based on his history and also what I'm seeing, the jaw is involved in some way. Now, this again is a little bit backward from what I normally see. So in terms of what a neuromuscular dentist may recommend in his particular situation, I'm not fully sure. But I'll show you a few other things here now that make me think, okay, the jaw is definitely involved with what is happening. So let's go ahead and slide forward here to a slightly different slice. Okay, there we go. We'll come on the side of the neck. And I want you to take note of this giant spikety thing that we see right here. First up, this is a normal piece of anatomy. It's called a styloid process. It's a normal attachment for a series of muscles that attach onto the bottom of the jaw, onto the back of the tongue, onto the back of the throat. and onto the top of the hyoid bone, which is a little bone in the front of the throat. It's actually located right here. And this is what allows you to swallow, which allows you to talk, all of these important human kinds of things. So this feature here, in and of itself, it should be there. But the thing about it is way bigger than we would normally expect it to be. So this guy oftentimes should only be about this big to where my mouse cursor is here, but instead we see it is quite elongated. This is what happens to bone when it is under constant tension for a long period of time. Body lays down calcium and the bone starts to get bigger. So this is what's known as an elongated styloid process. And when it reaches upwards of around 25 millimeters, we know, okay, there's going to be something that is creating jaw tension in this particular area. But he has it not just on the one side, but as you might be able to see, there we go. He also has it on the opposite side. So both sides of his head have this extension, which again is corroborating this idea. This gentleman has had very long-standing TMJ issues that has created a whole bunch of tension in this particular area right through there. Okay, what I've got now, this would be like a giant model of the front of the head right here, but the face is obviously taken off. So this is the back of the head. Top vertebra in the neck, here's the C2, and I'm going to illustrate there are those little spikety things, and that's how big they're supposed to be. So you saw in his image, it's actually extending all the way down like this. Now, what I'm going to do is I'm going to hold my finger right here. So just behind the spikety thing, but in front of the vertebra in the neck. This location right here is where you have a number of very important blood vessels and also a series of nerves. So number one, you're going to have the internal jugular vein, the major vein that drains blood from the head. You also have the internal carotid artery, which is supplying blood to the front part of the brain up through here and also this area right there. It's involved with sensation everywhere in your body. It's involved with movement, and guess what? It's also involved in the prefrontal cortex. This has everything to do with mood, memory, feeling, and is the one that is most commonly affected if a person ever starts to experience a neurodegenerative disease, aka a dementia. So something that's affecting circulation up to the brain isn't getting the right amount of blood, then that can be a pretty big problem. This area also is going to include the vagus nerve, the glossopharyngeal nerve that's involved respectively with heart, lungs, digestive system, swallowing. It's also the area for the spinal accessory nerve, which controls shoulder movements. And it's also the area where you have a branch, something that's known as a posterior meningeal artery. That's supplying blood to the back centers of the skull right through this area here that are going to be involved with the cerebellum. So balance, equilibrium, a lot of different things like that. So when we're looking at a styloid process, we can get a depreciation or a proxy for what's going on. Because if you ever have where this guy is getting much, much bigger, it could be maybe not smushing or compressing or anything like that, but it's leaving less functional space for all of those delicate structures. So when you're moving your head different ways, it could be a potential source of mechanical irritation, kind of like having a pebble in your shoe. It's a phenomenon that's known as Eagle syndrome. So let's go back, have another look here. So again, we can't see the blood vessels on this particular scan. We would have to refer him out for specialized imaging where you can do blood studies and then you can see all the vessels. It's pretty cool, but I think an ultrasound would show more likely if there is actually some kind of a restriction there. And I did mention that to this gentleman, both he and his wife. They said no, he very recently did have a Doppler ultrasound. They didn't see signs of overt compression, but again, An ultrasound is done in a neutral position. He notices the symptoms are more pronounced when he is moving his head. So as things would be shifting, even if it's not compressing, it could be a source of mechanical irritation. So I'll come around and I'll show this from a slightly different perspective here. So what we're now doing is we're essentially looking top down through the base of the head. So this over here, this is the left side, this is the right side. So we can see the orientation of the top vertebra in the neck, and these white arcs that you see right here, that would be kind of like where we're looking at those styloid processes in a top-down profile. So I'll change the orientation just a little bit like this. Normal is considered to be where you've got a gap of about 3.5 millimeters. So this is going to be important. So let me just switch it up here a little bit. Bear with me. Aha, there we go, there we go. Okay, so I'm changing the orientation here just a little bit. So to help you out, I'll come back to midline for just a sec. So we'd be looking as if front on like this. So base of the skull, cross here. So here's the base of the skull where it meets the C1 vertebra right here. And then this peg that you see right in the middle, that's the tip of the C2 vertebra like that, but we're just sort of projecting through it. And these giant spikety things, those are those styloid processes that we just said, that again would be sitting right about here. So let's go forward just a little bit, and I'm going to change the orientation right there. So this is the total amount of functional space between that bone and between the tip of the C1 vertebra right there. Now this is on the left side. So let's go ahead and measure it. 2.5 millimeters. So this is approximately 25% smaller than it should be. Again, even if it's not compressing the vessels, it's meaning there's less functional space. So when moving the jaw, when moving the head, when moving the neck, that could actually become a little bit tighter. We don't know that, but again, it's trying to put these bits and pieces together to figure out what the solution's going to be. Let's have a look at the other side then. So switch it around. Okay, so here we are, front on again. Okay, so there's the tip of the C1, there's the spikety part, but let me move it just a little bit. There we go, there we go. Okay, so again, you can see that there is a little bit of a gap space there, but this one here looks to be a little bit tighter. 1.4 millimeters, so this one is about 50% smaller than it should be. So this would be a case where I'm thinking we're probably dealing with the constant jaw tension has created elongation of these bony structures here that is producing what at least clinically would correspond again with what's called an eagle syndrome. That is where the orientation of that spikety thing there, it's affecting circulation. And if you're affecting circulation to the brain, that can show up oh so terribly many different kinds of ways. Headache, neck pain, but guess what? Dizziness, vertigo, super duper common. So this would suggest that we're dealing with at least some kind of a TMJ issue. We already saw the decrease in the space, but now we're also seeing the tension on the bone, on those muscles, on those ligaments, which is adding further evidence that this is one of the major issues. Now, this gentleman is quite well into his 80s. So whether some kind of dental treatment is going to be appropriate for him at this point, I'm not 100% sure. For some people, indeed, when this condition is severe enough, it can require surgery, where what they do is they are actually whittling, they're shaving part of the bone away to increase that amount of functional space. It's always a risk-reward kind of thing. I'm not a surgeon, but it's like, well, there are certain cases where it may be necessary. It's not at the top of my list at the moment, because I'll cycle back and I'll show you one of the other things. We usually try to help people with this conservatively, because we see people with this kind of condition all of the time, and that can be helped by addressing the jaw and by also addressing the neck. But it's always the option that's in the back pocket. If it's ever pronounced enough, it might need to go down the surgical route. But we'll show you a few of the other things that he also has going on, because we haven't even really looked at the neck here at all. So let's go ahead and I'll show you what we see. So we're looking at the neck from a side profile here now, and I will call attention to this area right here. You might notice this little lipping phenomenon going on right there relative to here. So we're looking at the C3 as it sits on the C4 vertebra at the area where that joint is designed to move. I don't care whether it's in your neck, your low back, or your little toe. Joints are supposed to line up like this. So when we see an offset, as we see here like this, so this would be that lippity thing, that's telling me that the C3 has rocked backwards from its normal orientation. And joints of the neck supply also a huge amount of information to the brain for balance and equilibrium. It's a condition that's known as a cervicogenic dizziness and sometimes even a cervicogenic vertigo. So this can be both neurological, but it can also be because you've got a series of blood vessels that transmit through the neck, and if they have to take a bit of a sharp turn right there, again, they may not be getting squished, compressed, or crushed, but if the brain's expecting 100% blood flow and say it's only getting 98, in the moment that can cause a person to start to feel a little bit woozy, because these arteries are going to be supplying directly the centers of the brain that process balance and equilibrium information. So we do see that there's something not quite right in the neck here, and those are the kinds of conditions that we can help with. He also has I'll go back right there, a little bit of the same thing on the same side, or excuse me, on the opposite side. And then as where do I want to go? I'm just changing the contrast there a little. Where do we want to go? Okay. So also having a look that when we're looking at the spinal canal itself, that we're looking at the area where the spinal cord should normally sit. This should be bare minimum 12 millimeters wide, and I'm measuring it right there at 10 millimeters, and if I go a little bit lower, 5.8. So this is a condition that's known as a stenosis. Stenosis is where you have a narrowing of the spinal canal, which again means there's been some kind of an old physical injury. You've had the accumulation of wear and tear over a period of time, and this means that you've got more tension on the spinal cord itself. This can cause a person to have headaches, dizziness. It can also cause tingling down into the hands, and because the cord is the conduit of information all the way to the legs, this can also produce low back pain, numbness, tingling in the legs. This can even affect bowel and bladder function, and I do always mention that if and where a person ever starts having a loss of bowel or bladder function, that is a medical emergency. And it's not always coming from that area of the body. It can be coming from the low back. It can also be coming from the neck. Now, thank goodness this gentleman's not having that. But again, we're seeing evidence that the neck is contributing. It's decreasing the function of the body to a certain degree. So we need to see what can be done in those particular areas. So let me scroll forward here a little bit more. What I've just done here is I've drawn a little line now across the base of the skull here. And you might notice here's that little peggedy thing right there. This line should intersect with the tip of C2, so the tip of the C2 odontoid process right here. The fact that it doesn't, that's telling me that the upper part of the neck has misaligned forwards like this. That can only happen is if you have ligament damage to these areas right here, and that's caused by physical injuries. Like we said, he had a number of physical injuries, could have been any number over a period of time, and Body finds brilliant ways to compensate for this, but eventually it can start to get fatigued, tired, says, dude, we can't do this anymore, and that's when we start to experience symptoms. Now, let's think about this for a sec. So firstly, I'm not seeing evidence of instability that would suggest like, oh my goodness, his head's falling off, we need to get him for surgery or anything like that. No, there's nothing like that that's going on in this gentleman's case. But if you have the top two vertebrae in the neck that have translated forward, so they've shifted forward like this, and you also have tension of that ligament that we were talking about with the jaw just a second ago, you have the blood vessels sitting here and the nerves, so you've got tension that's pushing things like this. So mechanical irritation from both the jaw and from the neck, saying that this kind of a phenomenon is going on. And this is why we believe a lot of people do respond without needing surgery. If you can actually make the right kind of correction and help those little ligaments, help those joints move the way that they are supposed to, even if they're not 100% perfect, if you can get even 1 to 2 millimeters worth of decompression in that area, that is often enough where a person says, oh, thank goodness, I start feeling better. So again, we're looking at the jaw, and then we're seeing these issues at the neck here. So as a bit of a recap, what are my thoughts for this individual? Again, I'm seeing that there's a few different layers. Number one, I'm seeing the nature of the underbite, and I'm seeing that TMJ is not the right way it's supposed to be. Number two, I see the chronic tension of that styloid process, the spikety thing in the neck, and that is producing a little bit of narrowing in those areas where we've got a lot of delicate nerves and blood vessels that are associated with brain health. I'm also seeing where we have evidence where one of the lower joints of the neck is starting to produce a bit of mechanical irritation one way, but then in the upper part of the neck, I see that the vertebrae are starting to go forward there just a little bit. So we've essentially got 4 different, simply put, mechanical things that are going on. What I also strongly suspect for this person, because he has had a previous episode, again, he had a stroke some years ago, that there's a certain amount of damage that has happened to the brain. And if the brain, over a period of time, it's not getting oxygen, it's not getting energy, it's not getting nutrients, then the bandwidth starts to go down, and it doesn't take as much physical, chemical, or even mental, emotional stress to start to throw things off. And because the balance systems of the brain are so delicate and require so many different forms of input, my suspicion is that this is also contributing, which means that there's not one magic solution in his case. What I would be looking at, and this is what I've recommended him, number one would be making sure that he's got right amounts of brain nutrition supplements. So these are omega-3s, this is creatine, this is going to be vitamin D, this is going to be magnesium, this is going to be glutathione, all of the stuff that your brain needs to be able to work. You got to supply it with the raw materials. Number two would be cleaning up any amounts of inflammation that are in his body, because inflammation, number one source, is going to be through our diet. Same thing, garbage in, garbage out. You're putting bad things into the body, brain and things are simply not going to work the right way. Number three, looking to see what can be done from the jaw perspective. And that one there, again, I'm not 100% sure what would be able to be done to help. But then number four, this is the piece that we would be able to help with, would be looking at that upper neck misalignment, looking at that lower neck misalignment, and again, trying to improve the functional space and the mobility so that even though we've got the arthritis, even though we have some degree of the irreversible damage, if we can help restore that normal function, even a millimeter or two, that it be enough where body says, okay, not perfect, but we can work with this, and where we would expect for things to start feeling better. I oftentimes say this for people when they experience balance kind of issues. They ask me, Jeff, do you see light at the end of the tunnel? The answer is no. But the reason is because the question is wrong. When a person's dealing with balance equilibrium, they're not in a tunnel. This is more like a maze in the dark. There are a few dead ends. There can be a few wrong turns. Is there light at the end? I absolutely believe that. The body does not stop healing until we take our last breath. But the kicker is that we often don't see that light until we've made that right turn. So when we're dealing with multiple layers of things that are going on, structural, functional, we've got to figure out what the right sequence is and what that right combination is so that we can get the best kinds of breakthrough. But the reason I say this also is because anything a person ever does for their health well-being, I don't care if it's diet, exercise, PT, chiropractic, surgery. You've got to be getting functional improvements within 6 to 12 weeks. I would love to say snap of the fingers, and I would love to say that one magic cure fix everything 100%, but that would not be true. It's solving this piece, and then this piece, and then this piece, and then this piece. So I had let him know that is I wouldn't make any recommendation of care unless I was optimistic that we could get at least a 30% restoration of function. And in his own case, it's like, okay, am I seeing enough evidence here that yes, we could help him out? I'd be optimistic. Now, I do think that it's going to take some time, and I also think that there's other things that we're going to have to work with along the way. I don't think that we can get it 100% perfect, but at the end of the day, as I had said to him, it's about quality of life. We don't know how many days, how many months, how many years each of us has in us. No matter what we think, we could be gone tomorrow, we could be gone 2 years, we could be gone 20, who knows, we could be gone 200 years from now. Odds are no, we don't know when our time is. So simply put, we always do the very best that we can to help people out and to make sure that people are able to actually do and live life the way that they want here. So a bit of a broad brush overview, just of a case here of, again, one of the more common symptoms that people do experience, but just sort of walking through and then showing, not just for him, not just for wife, but for other people out there, that the truth is there's a lot of moving pieces that go into this. And try as we might to say we have the one thing that solves it all, again, it's simply not true. It's solving the pieces and then doing the very best that we can. So thank you guys for watching. Do hope you found the video informative, valuable, a little bit entertaining, not too boring. If you enjoyed it, please do click that like and subscribe button. And if you've got friend, family member, client, colleague you think could benefit from watching this, please share this video with them. So thank you guys for watching. This is Dr. Jeffrey Hanna at Clear Chiropractic. Get well, live well, stay well. Till next time, take care. Bye-bye.